Hello and welcome. My name is Rosanna Varona, and I am in the Health Information Technology Associates program here at MDC Medical Campus. And today we're going to explore the comprehensive workflow of a dental office, focusing on patient registration, data management, regulatory compliance, and operational efficiency. My hope today is that everyone walks away with a better understanding of the importance of health information management and how it's used in everyday operations, but in very specialized areas of health. The goal really is to have you guys start thinking of all the other facility types and health organizations that may not be hospital centered, but still need to maintain streamlined processes in order to enhance patient care and ensure regulatory compliance while also maintaining efficiency, safety, and accuracy at the forefront of everyday operations. I ask that you please hold any questions till the very end, as I have endeavored to make this overview as in depth and detailed as possible from my 15 years' experience of working in this particular field. But I also hope that you guys are comfortable, hydrated, and hopefully excited to learn something new today. So let's get into it. Let's start with the patient registration process. And here I've included demographic collection, medical history, which needs to be updated at each encounter, insurance verification, and of course, HIPAA compliance, notice of privacy practices, and the file management, whether it's electronic, paper, hybrid, also very important. So, accurate demographic and insurance information are crucial for billing and HIPAA compliance, and implementing an EHR system does help streamline this process and reduce errors. Now, fully digital systems here in South Florida, the most commonly used software platforms are Dentrix, EagleSoft, and Open Dental. This is kind of the equivalent of Epic, Cerner, or perhaps Meditech for hospital systems. Here's the thing: electronic integration really does come at a price. And how much integration you have into your patient charts will depend on what the office can afford. Because again, as each of the additional feature is introduced, it comes at a price. So your platform, as you add on, it will just become more and more. And it is a monthly fee to be able to upkeep these systems. Small private practices, especially, will have to really look at the overall operational budget and decide what features are truly needed and best suited for the clinic of their size and capabilities, their patient base. Like, how many patients are they really seeing, whether it's in a week, a month, a year, and really what's going to help them run efficiently, remain compliant, and still maintain patient centered care at the forefront. When it comes to charts, there's still a lot of paper that exists to an extent because many offices will have patients fill out paper forms for demographics and the insurance intake and all that and the initial medical history. And even though later on the doctor, hygienist, or other additional staff, whether it's front desk or the dental assistant, they may do direct confirmation with patients and update any changes into the chart accordingly. And the system will track who and when these updates were made by, so that information integrity is kept and user actions are recorded for future audit tracking. Specialists are really the ones that maintain that paper route open because oral surgeons, periodontists, endodontists, orthodontists, cardiologists, oncologists, and so on will usually mail, fax, or email patient reports, and all this has to be integrated into the patient chart. And like I said, how much integration is available to your office really depends on what your office can afford to integrate or to take on. So most of the time, it costs a lot less to go ahead and print one copy of a report, or if you can directly upload images, that's great, but not every system or software will allow you that. So, and it's not just reports, it could be a diagnostic, a surgical, but it could also be medical clearance, lab results, and like I said, radiology imaging, all of which is important to maintain as up to date as you can in patient charts, which is why many offices end up having some hybrid combination of the paper, the HR format. And this includes for systems that have integrated insurance verification, and even insurance companies now will have, a lot of providers will have provider portals where verification and other specific plan details can be looked up and achieved, and this helps reduce claim denials and cut back on the time for claims. But again, this is still contingent on the individual capabilities of the clinic. So this is not the same across the board everywhere you go. And I mention this again because I want you to keep that in mind, because you don't know where you're going to end up working later on once you're done with school. But keep in mind that you're still going to need to know, sometimes if you end up in a rural clinic somewhere, you're going to need to know how to do the filing systems and the color coding and all that, and the basic charting. Sometimes old school is the way to go in certain situations. If there's an emergency situation and you run out of power, which has happened to me, I've had to go back to paper charting for a day and you make do, which is why it's important to know what your procedures and protocols are in those situations. Next, we have data quality review. Okay, data quality basically ensures accurate billing, reporting, and clinical decision making. So, extremely important. This is making sure that you are verifying patient information at every encounter, whether it's during phone, email interactions. Make sure that you are constantly updating and making notes of everything. I cannot stress the importance of staff being trained to ask for updates at several points throughout an encounter. Don't just ask at the beginning of the appointment. Sometimes even the patient will sit through an entire appointment before they remembered, oh, that's right, I had a hip replacement last month. Is that important? Why, yes, it is, Sally. That is very important. Let me tell you why. Patients will forget or omit information at the dental office thinking it doesn't matter. It won't affect their treatment or their health, but this is far from accurate. Dental health is an integral part of overall health, and not communicating medical updates to your practitioner could, in fact, inadvertently be detrimental to your overall health. Examples are weakened immune systems, whether it's cancer or chemo and radiation therapies, autoimmune diseases, medications such as blood thinners and osteoporosis medications, heart disease. If you have some form of transplant or implant, what we do in the dental office could affect the viability and outcome, whether or not your body rejects it over time or how it deals with it. It's extremely important to be open and always communicate any medical changes to your dental provider. Now, depending on the size of the clinic, whether you can do it daily, weekly, but no less than monthly. I think audits of EHR entries for completeness and correctness should be considered best practices. It can get away from you very quickly. And staying organized ahead of the administrative aspects of patient care are just as important as providing patient-centered care. You can't help patients achieve the best outcomes without the information necessary to do so. Old or incorrect patient data can hinder treatment and slow down the approval process on treatment plans and claims approval, which is why some form of integrated system and tracking systems is important to be able to ensure that easy retrieval and security at the same time. You want to make it work for you and be efficient while still maintaining HIPAA compliance. Okay, patient census and demographics at the dental office. Some of these include what is the average number of patients seen per day, per week, per month? Who's your population? Who are you treating? And maybe the average patient age. Are you treating more men than women? When it comes to that, what type of health issues do you keep in mind? As I mentioned earlier, some of the medications, such as the blood thinners. A lot of male patients will completely forget to mention that. And you could be in the middle of the crown and the patient is just bleeding and you're like, why are you bleeding so much? Oh, I took my blood thinner this morning. You think that affects it? Why, yes, John, I do think that affects it. Also, the osteoporosis medication. That can have huge effect on especially dental implants when you go to extract a tooth. Again, it's important to know your demographic, know the issues that they deal with, and how to better care for them. Because basic census tracking informs many aspects of your office. It'll inform staffing, not just the staffing needs, but language that you should be incorporated into the office when you go to hire. It affects your resource allocation. I personally in my office don't need as many child-sized prophy brushes because I will see maybe 10 kids in a week versus 100 adults. So I'm not going to have that in stock as often as I will the adult-sized ones. And infection control and planning. Maintaining staff and patient safety is just as important as maintaining patient privacy. And you can protect both. Some diseases are obvious, and your staff needs to be trained on respecting patients' rights to not divulge that information while still maintaining infection control standards and staying aware. Now, and dental offices also track demographics to analyze patient trends, service planning, and tailor services. Understanding your patient age groups and their health needs and wants helps your clinic tailor treatment offerings and really, again, make sure that your office has patient care at the forefront of everything you're doing. Okay, next we have coding and billing. Accurate coding ensures correct reimbursement and reduces audits. Utilizing updated coding systems, as the yearly updated current dental terminology manual, is essential. Staff verify procedure codes before submission constantly. In my professional experience, after 15 years in this field, 9 out of 10 times, insurances will not pay for a claim if medical necessity is not proven, whether it be by a narrative, x ray, both. Something has to show that you're not just doing procedures for the heck of it, you are doing it because the patient needs it. Best practices equals getting more extensive and expensive treatments pre-estimated before beginning treatment. After a certain threshold, for sure, it's always safer to pre-estimate and talk to the insurance company, send an x-ray and verify. Then have the patient, oh no, I'm sure they'll cover it. They go to do something, $1,000, and it ends up being their responsibility. And you may never see that money again because perhaps the patient doesn't have the capability, and they will argue that I was not told before I was treated that I would have to pay for this. Again, this way there is clarity, transparency in treatment costs and coverage. And even with pre-treatment, you may still have to follow up and dispute. Prior authorization does not mean automatic approval for payment. I've learned that the hard way. Sometimes you have to go back and you have to continue to show that proof of medical necessity. But that is part of our job. And it is an important aspect of our job because at the end of the day, it's what keeps the clinic going. If you're not bringing in any type of revenue, you won't be able to continue to practice, unfortunately. As much as we're here to help patients and we want to take care of them and we want to do the best of our ability and make sure that we are being compliant, we also have to make sure that the business is being positive, in the green, and bringing in an income. And this is where I will show you the revenue cycle flowchart. Basically, at patient scheduling and registration, that's where you collect insurance information and you try to verify benefits if you can beforehand. Just to make sure you're a network that your doctor can even see the patient and it won't end up being the patient's responsibility to cover the whole cost of treatment. Then treatment or services provided. And once the patient receives treatment, such as any dental procedures, whether it's a crown, fillings, cleaning, x-rays, these services are meticulously documented in the electronic health record so that we can then do coding and charge capture. So healthcare providers assign appropriate CPT codes to the documented procedures, ensuring precise billing. Then you will submit your claims and you will see if either you have a payment post after insurance company processes the claim, looks through the patient's coverage, all the clauses and by clauses and small prints of their insurance plan, and they issue a payment. Great. That should come directly into you, whether it is a direct deposit, whether it is a paper card check, what in the mail, and then you should update the patient's chart. But sometimes it doesn't happen that easily, and you may have to do a follow-up. Call and find out, hey, what's happening? I did a pre-authorization. My pre-authorization number is, BEXY1034. What's going on? Oh, we're missing x-rays. I'm like, well, it was pre-authorized with an x-ray. If you look at your patient portal, your information, you should see that this has a pre-approval because you guys should already have x-rays. And then they'll start looking in their system at the sub files that they have. And then all of a sudden the x-ray appears. Oh, we'll go ahead and reprocess that, give us 15 business days. And sometimes you may have to do this more than once for the same claim. It happens. Nothing is as streamlined, even as digital as we are in the year 2025, as everyone would have us believe. But this is what we have working for us. So, follow up. Hopefully, you get a payment post, and then you can update your accounts receivable. And this step involves identifying any unpaid or denied claims. Sometimes they pre approve and they say, oh, but the patient went to go see the orthodontist in between and we paid them. So, should they have less money left in their max? So, they have, $362 difference, and it's on them to cover it. Okay, fair enough. So, you proactively following up with either the insurance company or the patient to resolve these issues is extremely important. So again, as we continue to update the accounts receivable and the revenues, we have follow-up several times. Once you verify that the insurance is not going to pay anything else, that's it, they've met their responsibility, we now have to take it back to the patient. Sometimes we completely skip the payment posting, and for whatever reason, the insurance says, no, that's not covered. I don't know why. I don't know what happened. Could be an error, whatever it is. I've heard some things. I've had some issues. Sometimes I have to go directly from claim submission to follow up to patient billing because I'm sorry, what you thought was true is not true. And this is what your insurance says. The insurance company will only talk to me to a certain extent. Really, the ones who can advocate for themselves are the patient themselves. Unless they work for a corporation or a group big enough, like I have patients who work for the county, maybe at Health System. What other big groups? Norwegian Cruise Line. Those bigger groups that have many employees, so they have a bigger income like a bigger influx of money going into that provider, that insurance company, will a lot of times have some form of advocate working with their group, and they can go ahead and speak directly to their patient advocate, to the insurance, and sometimes that will help them. It won't happen right away. I've had patient advocates fight for 2 or 3 months with me to get a patient get something approval, but eventually, hopefully, you put in the legwork and it can happen. But nothing, again, is as easy as the system would have you think. So once you've done all the fighting, all the documentation, the back and forth that you can, you get your statements ready, you generate it for the patient, you send it to them reflecting the remaining balance, all the payments necessary and why, adjustments, everything that you could help. And again, you're going to have to do a follow-up because whether you can directly collect from the patient or the patient does not respond right away, they'll see you in 6 months and did you remember? Oh, I forgot about that. And then still, so you're constantly updating your revenue cycle, your accounts receivable, checking and following up until you get to your final step, which is the reporting and analysis, which is crucial. You want to continuously monitor your revenue. You're analyzing reimbursement trends, identifying write-ups, how much you're really losing. And this helps optimize the financial health of your practice. And this structured flow ensures that health entities efficiently manage their finances, minimizing errors, and ultimately enhance the patient billing experience. But like I said, all of this takes time to learn, practice, and really having set systems and procedures, protocols in place so that this is what I have to do, this is what I have to follow up, this already came in, and it's a continuous cycle. It is never ending, but we get it done. Now, let's see. Next, we have release of information and HIPAA. Okay, patient authorization is required for record release. HIPAA compliance, it's important because it's basically protecting patient privacy. And staff should be fully trained in both HIPAA privacy and security rules. Now, as I said, ROI is only allowed with signed authorization. Electronic portals and systems must have secure authentication and should never be left open or unattended because, again, this breaks the HIPAA rules. Let's go over them. HIPAA is the federal regulation paramount in safeguarding patient information, private patient information. And the HIPAA privacy rule restricts disclosures of PHI without patient authorization, while the HIPAA security rule addresses the responsibility of health organizations to use technical safeguards, such as automatic log off and secure access controls. So, HIPAA, which stands for Health Insurance Portability and Accountability Act, is designed to protect patients' privacy. It ensures the confidentiality of their private health information, and that also includes electronic health information. So anything that comes into your office or anything that's going out of your office electronically is also protected health, like privately protected health information. And understanding HIPAA is critical for all health professionals, as violations can lead to legal penalties, fines, and loss of trust between your practice and your patients. This is strictly followed in all dental offices, in all medical offices, in all rehab centers, in all, you name it, hospitals, lab lab centers, wherever you go. HIPAA should be followed, mandated, trained, and not just trained once, it should be yearly gone over and make sure that staff, personnel really understand the importance and how to really stay compliant. The most common HIPAA violations are unauthorized access, people seeing patient charts when they shouldn't, or some type of information from a patient chart when they shouldn't. You forgot to turn off your screen when you walked away. Improper disposal, not properly shredding, or having a company that is HIPAA compliant to go ahead and dispose of these medical records, and just having patient information laying around. Denying patient access, because patients have the right to access their information, even though patient charts are part of the business and they are a business asset that is owned by the business. The patient still has the authority to change the information in their chart if it's wrong, and they have the authority to access it, to verify, and you can't really keep them from it. You cannot gatekeep. You can only protect it. Insufficient employee training, breach notification failures, that's a big one, especially in the age that we're living now where hackers and people get into places where they should not. It is a constant battle. The current one now is that because Google has now changed and Windows is now up at 11, a lot of the dental softwares have to do complete overhauls for security. And they're telling, at least in my office, they're telling us it's going to take at least another year, even though it's already switched over, before security is where it needs to be at. So for the time being, Google is actually taking on the cost for a lot of, between, at least for EagleSoft, I'm not sure about the other ones, is taking on the cost and giving the free security protection to offices such as mine that are small and still working on doing complete system overhauls. Because, like I said, a lot of this depends on the capability of the office. Not every office has the capability to do an entire software and system overhaul in a month or two. So sometimes staying compliant means knowing how far you can take the technology in your office. Let's see, what other? Breach notification failure, inappropriate sharing. That's a big one. You don't talk about patient health information. You don't share with other people. Unsecured transmission, whether it's via fax, the phone, email. Always make sure that you're sharing patient information through encryption. And the newest one, social media misuse. So let's do some key takeaways real quick from HIPAA. HIPAA compliance requires vigilance, proper training, and secure handling of all patient health information, PHI. Violations can happen in any healthcare facility. It does not matter the size and or the location. It often results from lapses in procedures, technology use, or staff awareness. Sometimes it's the simple things that really catch us. Protecting patient privacy involves not only securing records, but also following proper communication and disposal protocols and reporting breaches immediately. Now, mastering HIPAA ensures that healthcare professionals maintain patient trust, comply with federal regulations, and safeguard sensitive health information. And it also safeguards you from dealing with litigation, because we are living in an era where it's very easy to put up a lawsuit. Anybody can put. So the simplest things that you could do to protect yourself is just follow the rules and regulations. Stay HIPAA compliant and just make sure that your staff is trained and aware of all the protocols that they should be following. Now, let's see. Next, we have the ROI flowchart. This one's pretty simple. A request will come in, and whether it's a patient, a legal representative, or a third party submits a request, you need to verify at all points. And any request that comes in needs to be documented. And whoever you verify and whatever verification you do confirm needs to be documented. You then retrieve the data, locate the patient chart, whether it is hybrid, paper, electronic, figure out what part. They may not always be asking you for the medical record. They might only want the revenue side of the chart. Verify what is it you want. They may only want the most recent x-rays. Make sure that you know exactly what part of the chart is being requested and that you're only sending what is being requested and what was approved by the patient or verified. Review and redaction if needed. Remove non-relevant or sensitive information, which is HIPAA protected. Very important. Release of approval. Now, always ask a supervisor or manager approval for release. You may not know as a staff personnel, perhaps the office is in the middle of litigation and they haven't flagged it yet. It may have come in that very morning. So just, as an extra precaution, it's always good to make sure you ask, whether it's your supervisor, your lead, the manager, hey, they're requesting. Is it okay if I go ahead and, because it has happened before. Run it up the chain just to protect yourself. Now, delivery. When delivering, whether it's by fax, email, mail, make sure that it is encrypted, it is secure, or if you're handling it physically, that you are verifying that the person who is picking up this copy is the person that should be handling this copy. Okay? So, and all roads lead back to documentation. All requests with the date, the recipient, the method of release, who you spoke to, why, everything should be logged and recorded and documented in the patient chart so that we constantly have a trail of how this chart was handled, who handled it, and why at all times. You also want to be ready just in case if you have some form of compliance auditing come in, whether, as Professor said earlier, whether it's the Joint Commission, whether it's the Florida Medical Board, or an insurance company. Make sure you have all your T's crossed and your I's dotted and everything is compliant, documented, and accounted for. Now, OSHA and infection control. Just as in hospitals, where the HIM is a lot of the times, the HIM department is a lot of the times responsible for training and making sure that staff is up to date in certifications and all that, we do the same in dental offices. OSHA mainly ensures employee safety, but adhering to OSHA standards also ensures a safe environment for your patients and your staff. Infection control is an integral part of protecting patients and staff, and proper medical waste handling and disposal is extremely important and should always be adhered. Dental offices are required to have yearly training on all three. That's OSHA, infection control, and medical waste. And we also have to prove compliance and certification at yearly inspections. Office OSHA manuals must be kept up to date, and this includes information sheets on chemical components of all products used. And that's products used to sanitize, products used on patients, products used by staff. Everything is recorded and kept and made sure that it's up to date. Radiology machines are also inspected on a yearly basis to ensure proper maintenance and safety protocols are being followed, and there's certification for that. Dentists, like I said, are required to complete medical errors and infection control certification every 2 years as part of maintaining an active dental license. And most offices, I've yet to see an office that does not, will go ahead and train office staff at this time, and they will complete the course as a group. so that everyone and hygienists can get continuing education, CE credits. And so that staff maintains vigilance and are aware of the best practices in patient safety and infection control, which is extremely important. Florida Department of Health does yearly inspections, like I said before, and you will get shut down if you're not compliant. I've had several doctors that I've worked with in the past, maybe a specialist or that we've been at conferences together, that they will get shut down for the smallest things, which is important. This is why it's always important to do your yearly training and make sure that you are updating your protocols, your procedures, sterilization practices, sharps disposal, all of that, proper hand washing, all of that should be trained and updated on a yearly basis, because people will fall into the monotony of every day and they will forget, they will get sloppy, and that's just part of humans. That's how we are. So it's important that we continuously retrain our minds to make sure and just check that we are still doing best practices at all times, especially for this being so important. This is part of keeping yourselves and patients safe. And I cannot stress the importance of that enough. Oh, PPE, let's not forget. Daily sterilization routines, autoclaving, making sure that your instruments are sanitized, and that everyone knows and follows sanitation protocols. Um, Interesting note, dental offices statistically had the lowest numbers of infection during the height of COVID, and you were actually more likely to get infected on the way to your appointment than you were during your treatment, because dental personnel have been using full PPE for decades, and our sanitation protocols are more stringent than regular medical offices were at the time. I'm not sure how it is post COVID. I know that dental offices continue to do all the steps and procedures that we've always done to make sure that everything is sterilized, sanitized, cleaned, and that staff are protected, which in turn protects patients. Dental personnel were actually the last to receive, due to this. They were the last ones to receive approval for COVID vaccines from the state. Even though we are medical providers, because our numbers of infection were so low that hospital and medical staff who were in the front line, and I agree this, rightly so, were given the first few waves of available vaccines, and we had to wait till almost the very end of medical providers that could. So keep in mind, a dental office is a great place to learn proper infection control, if I'm being honest. Let's see here. Proper medical record management. As you see, this includes tracking, record retention, disposal, transcription, faxing, and duplicating. Let's get into it. HIM best practices, proper indexing improves retrieval efficiency. You update inactive patients list in your EHR, and you make sure to make charts that are inactive, and that you are deleting them or disposing of them HIPAA compliant once retention period is over. Once you reach your retention period, there's no need to keep charts backed up or saved, or you're just opening yourself up for more chances of a misstep in auditing and compliance. So always adhere to your retention period and proper disposal protocol. Tracking ensures compliance with HIPAA and state regulations for patient access, but it also helps protect your clinic, like I said, from possible litigation. Retention policy in the state of Florida is 7 years after your last encounter for adults, or after your patient turns 21, whichever is longer when it comes to children. Transcription workflow is basically dictation, review, and then you upload to the EHR. You want to make sure that whatever doctor, the hygienist, the doctor's assistant, each person has their access control, and whatever is being uploaded is being reviewed and signed off by the doctor before uploading or being saved indefinitely into the EHR and the patient's chart. Accuracy and timeliness on transcriptions are held in dental offices just as they are in hospitals and medical clinics, or as they should be. Now, when it comes to faxing and copying, these are also done with HIPAA safeguards in place. HIPAA requires encrypted fax and email for sending patient information outside of the office, and these are strictly adhered to. Now, medical records section manages physical and digital archives, and this ensures retrievability for audits, insurance, or litigation, as I already mentioned. So as you can see, it does not matter the facility type, it does not matter the size. You still need to be compliant. You still need to follow all regulations and protocols, and you need to have procedures and systems in place for best practices to keep, again, patients are at the forefront, but your staff and personnel, your doctors, are just as important. And at the end of the day, you just want to keep everyone safe and be able to continue working and help your patients. Let's look at the PHI, or patient health information flow chart. Tracking patient information. Okay. Patient registration to record creation, data entry and quality review. We already spoke about patient registration. That's where you collect your demographics, whether it's name of birth, name, date of birth, or social security number, all that information for insurance verification. We talked about the record creation of whether it's paper, hybrid, electronic, some combination of, you always want to make sure that you have your organization, however it does it, whether it's assigning a file folder number, a patient number, an account number, a FIN number, however it is you do it, you want to make sure that your system is updated and that your personnel understands how your system works and how to keep patients' charts organized and try to avoid duplicates and try to avoid any type of errors like charting in a patient's son instead of them because you forgot that there's a junior and a senior and maybe there's a third. Storage and security. Secure filing, whether it's password protected systems or lock cabinets. Again, HIPAA compliance. You want to make sure that you are always HIPAA compliance and that you are following proper procedures and protocols. Access controls, as we discussed. Only authorized staff should have access to all or any parts of of patient health information. They should only be able to access what they need to be able to get their jobs done to the best of their abilities. They don't need access beyond that. Now, retention and disposal. Retention, you want to follow both state and federal policies, but of course, federal will always trump. And the biggest thing is making sure that your security and your safety protocols are at the highest capabilities that your practice can handle or be capable while still maintaining the security and compliance with HIPAA. Secure destruction, again, outdated PHI, there's no need to keep charts and records past the retention period because you are just opening yourself up to liability and the possibility of patient information getting out there when it should not. Security breaches, data breaches, they happen every day, and you don't want your office to be one. You definitely don't want to be in the 10 o'clock news, what is it, 10 o'clock news on Channel 6? Hey, South Florida dental office, major security breach. Nope, not us. So, in conclusion, yes, we finally came to the end. Efficient workflows enhance patient care and ensure compliance. Implementation of best practices leads to continuous improvement and positive patient outcomes. It is important to keep in mind just how many HIM practices are truly integral and central to the success of dental clinics and all other small specialized areas of healthcare. Coding and regulatory adherence in dental offices workflows are extremely important and they're constantly updated and being followed. Following these workflows improves patient satisfaction and office profitability. But more than anything, it ensures the safety of your staff and your patients and that your office maintains compliance so that you can maintain working and continue to help your patients. So that's it for me. Thank you so much. And I truly hope, like it says on the screen, I truly hope that you found this both interesting and informative, and that somewhere along the way you learned something about your dental office that you didn't know or you weren't aware just how much work and thought goes into it. And I hope it also opens you up to thinking about what other specialized areas of healthcare and facility types use HIM on a daily basis. And perhaps when I'm done here, I could go work at an area that's not necessarily a hospital. So thank you so much again for listening. And I truly hope that you all enjoyed.